Hello, my name is Barbara Blake, and I am the head of the Department of Allied Health Sciences. We are in the College of Sciences and Technologies, and our dean is Dr. John Doucet. So, what is allied health? We are a broad group of professionals who use sciences and evidence based practices to evaluate, treat, and diagnose individuals from infants to the elderly. Anyone who has a disease or disorder or an illness that causes issues with their health, we as allied health individuals can intervene. Our department has been highly successful in getting individuals into graduate schools to pursue occupational therapy, physical therapy, registered dietitians, speech language pathologists, physician's assistants, athletic trainers, and many, many other fields. What follows is an overview of several of our programs. Please take a minute to watch the video.
Hi, welcome to Health Sciences, Food and Nutrition Services. This concentration is one of the special concentrations that we have in health sciences that allows a student to pursue career options in nutrition and food services. The classes that you'll take as part of this degree program, you can see from the screen, are 8 hours of biology, 27 hours of dietetics courses, 14 hours of health science courses, 12 hours of psychology, and a lot more options. Things like medical sociology, medical Spanish, sign language. So this degree concentration really allows the student to kind of tailor the concentration and the degree to meet their desire to either move on to a career as a dietary manager, perhaps a health inspector or a sanitarian, a nutrition educator with a public health program, or go on to graduate school.
Hello, my name is Claire Bourgeois, and I'm an assistant professor here at Nichols, and I'm also a licensed speech language pathologist. So what I'm going to do today is tell you a little bit about the Health Science Communicative Disorders program here at Nichols. So why should I choose Health Sciences Communicative Disorders? Why communication disorders? So if you want to apply to graduate school to become a speech language pathologist, or if you want to apply to graduate school to become an audiologist, this would be the field for you. So that leads us to, what is a speech language pathologist and what is an audiologist? Well, first we'll start off with what is a speech language pathologist. A speech language pathologist is also called a speech therapist. And a speech language pathologist will work with individuals to help prevent, assess, diagnose, and treat speech language, social communication, cognitive communication, and swallowing disorders in children and adults. In other words, we can work with an individual who has difficulty producing that S sound, to an individual who stutters, to an individual who might have vocal nodules. Or we may work with adults, maybe that patient that is trying to learn to talk again after having a stroke, or learning to swallow again after having a stroke, or that individual with dementia, helping them to remember what day it is, what they need to do to eat, or the steps to actually communicate with other individuals. What is an audiologist? An audiologist is another area you can work in if you study the field of communication disorders. An audiologist is a healthcare professional who provides patient-centered care in prevention, identification, diagnosis, and evidence-based treatment of hearing, balance, and other auditory disorders for people of all ages. Hearing imbalance disorders are complex with medical, psychological, physical, social, educational, and employment implications. So an audiologist, just like a speech language pathologist, can work with individuals of all ages. This means an audiologist can work with someone from the day they are born in the hospital by completing a hearing screening to an elderly patient who has lost their hearing and needs to wear hearing aids. So is this the right major for me? Am I in the right field? Well, do you like the healthcare field but not sure what you really want to do? Then maybe this is the field for you. For example, you always thought, ooh, I would like to be a nurse, but oh, I couldn't give somebody a shot. Or any other of the duties that nurses do. Well, then maybe speech therapy or being a speech language pathologist is for you, because you can work in the hospital helping that individual to swallow again, helping that individual to actually talk again. Or maybe you like the school system, but you don't really want to be a teacher because you don't want that whole classroom. You always said, oh, I would really love to work with individuals who are autistic or have Down syndrome. Well, then again, maybe speech therapy is for you because you can work with those individuals on an individual basis and not with the whole class and really feel like you're making a difference. Or if that individual has a hearing impairment, then you can be an audiologist and work with those. So if you would like to work with individuals with disabilities, and then this might be the field for you. You can work with those individuals in the healthcare system, or you can work with individuals in the school system. If you have any questions, please feel free to reach out to me. As I said, my name is Claire Bourgeois, so you can email me at claire.bourgeois@nichols.edu. Hope you enjoyed this, and I hope it answered some of your questions about what communicative disorders is and what you can do with a degree in communicative disorders. Thank you.
Hello and welcome to Nichols Dietetics. On behalf of all of the dietetics faculty, we are so excited that you're part of the Nichols family, and we can't wait to tell you a little bit about our program. So each year, the dietetics faculty work really hard to maintain our accreditation from the Accrediting Council for Education in Nutrition and Dietetics, and all of this is done so that we can prepare our students to become registered dietitian nutritionists. Now, you may be asking, what is a registered dietitian? And that's okay. Registered dietitians use scientific evidence in many different career areas to help individuals live healthier lives through good nutrition. Dietitians in the practice area of clinical dietetics provide care to the acutely ill hospitalized patients and also work in outpatient clinics, helping individuals to navigate chronic diseases and other nutrition-related conditions. Registered dietitians, in fact, are the only professionals that Louisiana law states are competent to provide medical nutrition therapy. RDNs working in community nutrition develop and implement community programs that provide nutrition-focused education and other resources to help our communities thrive. Community nutritionists also work in research, sports nutrition, wellness, and health promotion. Finally, many registered dietitians work in healthcare management roles where they manage food and nutrition services operations at healthcare facilities. The field of nutrition and dietetics is rapidly growing, and so are the job opportunities. So how do you become a registered dietitian? The first step is to complete your undergraduate dietetics curriculum at Nichols. Second, you'll complete your dietetic internship. And then finally, you'll pass the credentialing exam for registered dietitian nutritionist. Now, the one change that has occurred recently is that if you are going to be taking your RD exam on January 1st, 2024 or later, you will need to have a master's degree. For dietitians to fill these critical roles, it's important that they have a strong foundation in the sciences. Our students take biology and chemistry courses that help to set the stage for biochemistry, nutrition and metabolism, and medical nutrition therapy. You'll also take other nutrition-focused courses on the topics of public policy and dietetics, nutrition counseling, and nutrition through life cycle. Because registered dietitians focus on evidence-based practices, our faculty incorporate many research modules into all of our courses. Beyond this, the dietetics program offers many high-impact learning opportunities that are fun. In skills labs, you'll practice foundational cooking techniques and learn how to write and modify recipes. You'll also practice skills in collecting anthropometric data and providing medical nutrition therapy. In your final year in our program, the dietetics students will conduct original research and often present their findings at the Nichols Expo. Finally, our Student Dietetic Association is a great way to make friends with like-minded individuals and to learn about volunteering opportunities. Throughout the dietetics curriculum, you'll get to engage and learn from our wonderful faculty. We are all registered dietitians with a diverse practice background. We are here to mentor you and to guide you into entering the dietetics field. If you would like more information, please visit our website at nichols.edu/allied-health-sciences/dietetics.
Hi, I'm Jennifer Plaisance. I'm an assistant professor of health sciences in the Department of Allied Health Sciences. I'm going to tell you a little bit today about our pre-professional concentration in the health sciences program. This concentration is for students who are interested in admission to various clinical professional programs. Our students ends up in graduate programs in occupational or physical therapy, physician assistant, master's programs, chiropractic programs, and various other graduate level programs in the healthcare field. Many of our students also pursue associate level programs or certificate programs once they finish their bachelor's degrees. Our students have become respiratory therapists, x-ray techs, which is radiologic technology, or ultrasound techs, which is diagnostic sonography, just to name a few. This concentration is full of sciences and really can be adapted to fit the needs of the student pursuing various professional programs. So a student can come and say that they are considering both occupational and physical therapy, or both physical therapy and chiropractic school. And we can work with those two programs, their prerequisites, and try to get the student all the coursework that they need to pursue those professional programs so that they don't have to make a decision quite so soon in their academic career. Similar to that, we do the same with the associate level programs. Students who are interested in a variety of fields can get prerequisites for those fields and then make decisions later in their academic career on which they wish to pursue. If you have any questions, my email is listed below, and please feel free to shoot me an email and I'd be happy to answer.
Well, hello. Let me take this opportunity to discuss with you our pre-athletic training concentration under the health sciences degree. Some of you may ask, what is athletic training? So in the world of sports, okay, there are individuals that deal with the medical side of sports, and then we have individuals, professionals that are out there working with the athletes and getting them faster, stronger, quicker. Sometimes we get a lot of individuals who feel like athletic training is a faster, stronger, quicker professional. But truth is, as an athletic trainer, we are healthcare professionals. So we're on the medical side of the sports. So you hear the phrase sports medicine a lot. And a lot of times you, as an athletic trainer, we are the aspect of sports medicine. So with athletic training, it encompasses the prevention, the examination, diagnosis, treatment, and rehabilitation of these emergent, acute, or chronic injuries and just general medical conditions that athletes may have. So as an athletic trainer who performs athletic training, we work with the teams and the sports. We work with physicians, and obviously we take care of the athletes. So the athlete is our primary concern when we deal with an athletic training and sports medicine. So, but we do have to work with a lot of different healthcare professionals. We work with physicians, we work with occupational therapists, we work with physical therapists, we work with dermatologists, we work with eye doctors. I mean, as an athletic trainer, we become the gatekeeper for healthcare for our student athletes. So it's a very important role that we play, and it's a critical role we play in the world of athletics. So with that, our degree, or the concentration that we have in pre-athletic training under the health sciences degree, the goal of our concentration is to get you, the student, to get you prepared for entry into a post-professional program in athletic training. So to be an athletic trainer, you have to graduate from a CATIE accredited athletic training education program. And right now, the athletic training education programs are all pretty much at the master's level. We used to be able to have it at the undergraduate level, but it's no longer allowed to be offered on the undergraduate level. So that's why we have our pre-athletic training curriculum concentration, where our concentration is designed to get you into the next level, into the master's level. So with that being said, the curriculum, we include the various natural science coursework, because you're going to have to apply to be accepted into a graduate program in athletic training. And part of that application process is prerequisite coursework. The athletic training master's level programs are going to require natural sciences like biology, chemistry, physics. So these are various courses that they're going to require. We also have a nutrition course that we offer through our dietetics program. We have the exercise and sports medicine courses. There's the health and human performance department that offers kinesiology, exercise physiology, motor development. We also have courses in athletic training that we offer within our Department of Allied Health Sciences, as well as other courses in Allied Health Sciences that you could take that will gear you up and prepare you for an athletic training master's level program. So the question becomes, do you want to be an athletic trainer? If you want to be an athletic trainer, come talk to us. Come talk to me. My name is Gerard White. I am an athletic trainer. I've been an athletic trainer now for over 30 years. So I'm very active within the profession. I would love to sit down and visit with you about what I do as an athletic trainer, what we do in the profession of athletic training. So contact me, email me, come by and see us. We'd love to sit down and visit with you about our pre-athletic training concentration here at Nichols. Well, hello there. Thanks for joining me. What I'd like to do with this brief video is talk to you about our health and wellness concentration that we offer within the health science degree. With this health and wellness concentration, the curriculum that we've developed for this concentration, we've included various courses in the natural sciences. We have courses in nutrition because of our dietetics program that we have. We have courses in exercise and sports medicine. So we've incorporated the courses in health and human performance, as well as the athletic training courses that we have. And also on top of it, we have our just general health science type courses. So this curriculum is designed to give you a well-rounded aspect and coursework and knowledge in health and in wellness. So some people may ask, what can you do with a concentration in health and wellness? Well, that's a great question. there's a lot of things you can do with it. The current uh, industry right now, the society is so much involved in health and wellness. So some of the aspects that you can do with it could be one, public health educator. Another aspect you can get involved in is corporate wellness as an educator or as a coordinator. You could get into community health as an educator or a worker. What about health, the fitness and strength coach? That's really becoming very popular right now with a fitness. Everyone's involved in fitness. You can get it as a personal fitness instructor, a personal trainer. There's a strength and conditioning. Those individuals work with individuals trying to be faster, stronger, quicker. So then lastly, you can get into what we refer to as the indirect ancillary patient care services. There's a lot of different ancillary services out there that you can be employed in. Some of it could be like medical assistant. You can get into radiology tech, or even sonography, ultrasound tech. So these are just a few career options and pathways. Hopefully this information has been beneficial to you to where you can then kind of to figure out what it is you want to do with a concentration in health and wellness.
I hope you enjoyed watching the videos and learning about the programs in our departments. I'd like to suggest that you go to our webpage where you can learn a lot more information. Here, you will see on our webpage information about the health sciences programs that were discussed in the videos, the dietetics programs, and what may or may not have been discussed, the minors in which are available within our department. In addition, you can scroll up and go to faculty and see all the individuals who are full-time employees here in our department. As you can see, we come from a diverse background. If there is more information that we can provide for you, we are happy to assist. Go to the top of the page and you will see Welcome. In the welcome screen, at the bottom, you will see the contact information for our department. We are located in Go Hall, and our office, my office number is 985-493-2624. My direct number is 985-448-4139. Come join us in the Allied Health Program.